Welcome to this episode of Happy Birthday Wellness Quiz, day 193. My name is Subiri Obuogo. I'm a medical doctor and specialist in public health medicine. In this second part series, I'm going to discuss whether exercise can protect my joints against damage or injury. In the first episode, we discussed why exercise does not cause damage to your joints. So in this episode, I'll start with myths and facts about exercise. As I mentioned, we discussed whether exercise can damage your joints in the first episode. Today I will discuss whether exercise can protect against damage to your joints. And then I'll sum up with 7 takeaways. In the third series, we'll compare joint damage in runners versus non-runners, runners versus swimmers, and champion runners versus non-athletes. Then in the final and last part, we'll discuss whether exercise can be prescribed for patients with arthritis. So here is a short quiz for which I will share the answer at the end. According to World Health Organization guidelines on physical activity and sedentary behavior, how many deaths could be prevented every year globally if the global population was more active? A, 10 million deaths, B, 5 million deaths, C, 3 million deaths, or E, 1 million deaths. So why is exercise good for your joints? First, we know that osteoarthritis, which is one of the most common types of arthritis, begins when the cartilage that cushions the joints begins to tear away. So when we talk about the cartilage, we're talking about this lining here that normally protects the bones and the joints. Now, because the cartilage does not have its own blood supply, it must get its nutrients from the fluid that beds the joints. So this fluid here is what supplies nutrients to the cartilage inside here. So exercise compresses joints, forcing nutrient-rich fluid into the cartilage. This is one of the hypotheses of why repetitive exercise is good for your joints. So does exercise really protect against joints? One of the most famous study in 1990s Australian knee study, it raised the question whether exercise can protect against knee arthritis. As I mentioned, we looked at evidence which shows that exercise doesn't damage your joints, but does it protect against knee arthritis? So the study enrolled 279 men and women aged between 40 and 69 who were followed up for 14 years. They were all healthy and they didn't have any knee injuries at the beginning. So the outcome measures of interest, all the participants, all the study officials were looking at was the person's weight, exercise habits, whether they're having joint stiff symptoms such as pain, and they also did knee joint MRI studies. Now, the results were quite astounding. First, people who performed the most vigorous weight-bearing exercise had the thickest and healthiest knee cartilage, meaning that exercise actually improves the quality of your joint and the cartilage and therefore protects you from damage. Exercise also is shown, as I mentioned, compresses joints, forcing more nutrient-rich fluid into the cartilage. So one way in which exercise protects joints is strengthens the muscles, ligaments, and tendons around the joints. When these tissues are strong, they act like a brace to protect the joint and lessen pressure on the weakened joint. So back to the quiz. According to WHO guidelines on physical activity and sedentary behavior, how many deaths would be prevented every year if global population was more active? The answer is between 4 and 5 million deaths could be prevented every year if people simply became more active. We talk about more active, we talk about moderate intensity physical activity, which basically includes 150 minutes per week, which is divided into 30 minutes every day for 5 days a week. So make sure you don't go more than 2 days without exercise. Now, moderate intensity activity includes things like cycling, walking, that is brisk walking, or cycling on a flat surface, as well as walking up and down the staircase. The idea here is to get your heart and lungs breathing much faster. Now, in addition to this aerobic exercise, you also require 2 days of muscle strengthening exercise to make this wholesome. Now, almost 500 million people will develop heart disease, obesity, diabetes, and other non-communicable diseases attributable to physical inactivity between 2020 and 2030. That is according to WHO estimates. So it's very important that people become more physically active. So here takeaways: exercise is good for health, but caution is advised in the following instances. Older patients and patients with heart disease, hypertension, diabetes, or other significant problems should get medical clearance. It's good to listen to your body and report any signs of discord to your doctor. Warming up and cooling down will help protect your body, your heart, and your joints. Also, it's smart to use the right equipment and right technique, whether it's stretching, shoes, because that will reduce your risk of musculoskeletal injuries. If you are unsure, particularly if you have underlying medical condition, it's important to work with a professional expert. If you follow these simple commonsensical precautions, it will render exercise safe for your joints, and no one should have excuses for not exercising. Daily moderate exercise should be part of your daily routine, as I mentioned. 30 minutes of moderate activities at least 5 days a week. This podcast was brought to you by Kike Afya. My name is Subiri Obogo. I'm a medical doctor and specialist in public health medicine. We rely on well wishers bring this content, and you can support us by commenting, liking, sharing, or subscribing to my YouTube channel. You can also support us through M-Pesa number 766500 or the mobile number 0720 958250. This is basically to enable us reach more people with this message. See you next time for the next episode.